Dyspepsia is common, with a population prevalence of between 20% and 40% in community-based surveys. The implicit assumption in studies such as these is that few individuals will have an organic explanation for their symptoms, and most will have functional dyspepsia. However, few studies have tested this assumption by offering participants upper gastrointestinal endoscopy, so the prevalence of clinically significant endoscopic findings in dyspepsia remains unclear. In addition, if the prevalence of these findings were known in individuals without dyspepsia, we would be able to assess the extent to which upper gastrointestinal symptoms are related to underlying organic pathology. We therefore conducted a systematic review and meta-analysis to examine this issue. We searched Medline and Embase through to April 2010 to identify cohort and case control studies, as well as cross-sectional surveys that reported the prevalence of dyspepsia in adults, and went on to offer all or a proportion of participants upper gastrointestinal endoscopy. Studies conducted in the community, the workplace, in screening clinics, or in family physician and general internal medical clinics were eligible for inclusion. Clinically significant findings included erosive esophagitis, Barrett's esophagus, peptic ulcer, and gastroesophageal malignancy. Articles were assessed independently by 2 reviewers using pre-designed eligibility forms. Data were extracted, again independently, by 2 reviewers in order to estimate the prevalence of each clinically significant endoscopic finding in individuals with dyspepsia as well as in those without. Data were pooled using a random effects model in order to report the pooled prevalence of each clinically significant endoscopic finding in dyspepsia, as well as to compare the prevalence of each finding in those with dyspepsia compared with those without, using an odds ratio. Our search strategy identified over 28,000 citations, and of these, 151 articles reported the prevalence of dyspepsia. 9 of these studies performed upper GI endoscopy in over 5,000 individuals and were therefore eligible for inclusion. The commonest clinically significant endoscopic finding in individuals with dyspepsia was erosive esophagitis, with a pooled prevalence of 13%, followed by peptic ulcer, with a pooled prevalence of 8%. The only clinically significant endoscopic finding that was commoner in individuals with dyspepsia compared with those without was peptic ulcer, with an odds ratio of 2, although this was only the case for duodenal ulcer, with an odds ratio of 3. We studied the effect of the criteria used to define dyspepsia on the prevalence of clinically significant findings. Studies that used a broad definition of dyspepsia gave the highest prevalence of erosive esophagitis, whilst studies that used the Rome criteria gave the highest prevalence of peptic ulcer. We also examined the effect of study location on prevalence of each finding. Far Eastern studies reported the lowest prevalence of erosive esophagitis, but the highest prevalence of peptic ulcer compared with Western studies. These data demonstrate that clinically significant findings are not detected in the majority of individuals with dyspepsia in the community. Even when such findings are encountered, it would appear most are no more likely to be present in individuals with dyspepsia than in those without.